As a practitioner, I only use products I believe in, and Nutridyne is at the top of that list. What I love about Nutridyne is their unwavering commitment to quality, transparency, and science. Their products are practitioner exclusive, which means they're built specifically for clinical use. And that matters when you're trying to get real results. From foundational support to condition-specific protocols, I've seen firsthand the difference Nutridyne makes in my patients' health and in my practice. Hey everybody, Dr. Rob Silverman here, Proven Health Alternatives. I've got an expert in many different things, specializing in functional medicine and fish oils. I've got Dr. Charles Sefcik. How are you, Doc?
Doing great. How are you doing?
I'm doing exciting. So let's cover some interesting topics. You know, when I reached out to you, I said, what do you want to talk about? And you're like, fish oils.
Fish
And I
oil.
was like, okay, I mean, every patient deserves a fish oil, etc. But why did you pick fish oils as a topic?
I really believe you mentioned every patient needs a fish oil. I actually check fatty acid status on every single new patient that walks in my practice. I look at before they get into hormone therapy, before they get into leaky gut repair, before they get into neurodegeneration prevention. What's your fatty acid status? So I really have seen miracles in practice with fatty acid treatments.
So today's topic, with a great preview by Dr. Charles, a healthy balance of essential fatty acids is critical for optimum health and wellness. In today's podcast, he and I are going to discuss the role of omega-3 fatty acids in key areas of your health, discuss what to look for in fish oil, how to test your omega-3 fatty acid levels, and what you need for a good oil change. A car needs an oil change. We need an oil change. And I've got some factoids to really start. The average consumption of EPA DHA per day is 150 milligrams of both EPA DHA. When we compare and contrast that with Greenland Eskimos, they eat 6 to 7 grams daily.
Mm-hmm.
So take that baton and tell me what you think about that.
Well, let's start with essential fatty acids, right? The very name, essential fatty acids. We have two camps. You have your omega-6s and your omega-3s. And they're called essential because you cannot manufacture them. You have to get them in your diet. So whether you're eating omega-3 rich foods, fish, or whether you're taking a supplement, you have to take them externally to be able to be used. And I think they should be called essential because they're essential for everything that the body needs. They really make up the cell membrane. I think it's Bruce Lipton that said membrane should be spelled membrain, the brain. Everything happens in that cell membrane. The magic is happening there. And so one of the most important things that these omega-3s do is they just maintain membrane fluidity. As we understand, if you're going to have a receptor bind to a cell, it's all about, can that cell undergo conformational change, or can that receptor, I use the analogy, the illustration of a fishing bobber. Can that bobber go above the water to where the hormone that's circulating through bind to that receptor, or is that bobber stuck in underneath the water? Is it stuck in a frozen lake in North Dakota in the middle of January? So if it's not able to have the fluidity to move around, then you're not going to have the receptor activation. So there's a lot of things that play into that, and so this is life critical processes we're talking about.
Without question, I concur with you. Every patient that comes in here, I make a recommendation for omega-3 fatty acids. The body has a receptor site for a few things, one of which is a receptor site on every cell for omega-3 fatty acids. To piggyback on your idea of essential, they're essential, like you said, because the body can only synthesize them. It can't synthesize them. It has to take them in from diet. They're great energy storage. They're great for cell structures. They have various other functions, one of which is hormone function. So all that being said, what do you think is the most important function of omega-3 fatty acids?
Far and above, it would be membrane fluidity. It would be that maintenance of the healthy fat in a membrane. Let's put it this way. If my cell membrane is rigid, then the machinery, the magic that happens in that membrane is not going to work because of the rigidity of that membrane. So fluidity is that concept that if something's put into the system can respond. I can move. If simple analogy, if I took a hair and I dropped it into some fish oil, I would see the ripple effect. If I took a hair and dropped it into Crisco, it's going to just sit there and it's going to be very hardened. So we can kind of get that. Maybe it's a poor illustration, but I think we get the concept of what fluidity is. But when you look at fish oil, there's actually, this is Dr. Alex Vasquez, who shared it does four things. Fish oil can decrease inflammation.
Mhm.
We understand that inflammation is the root cause of every chronic disease. And we look at all the things that we can do to remove inflammation from the body. Fatty acids are critical for that, fish oil in particular. Secondly, it can be used in neurochemical, neurotransmitter, and hormone receptor activation. So there again, if someone comes in with anxiety, depression, insomnia, any neurobehavioral disorder, consider the integrity of their fatty acid status. I always tell patients, your behavior is dependent upon how well your brain works. I think that Dr. Mark Hyman taught us all the concept of a broken brain. We don't have pain receptors in our brain. So if the brain is broken, what's the person to do? They're going to manifest some neurobehavioral. They're going to have anxiety. They're going to have depression. And so we'll see these individuals. Had a young kid come in with Tourette's. His omega-3 fatty acid stats, which we'll talk more about testing later, but was just very, very, very low. So you have the inflammation, you have the neurotransmitter hormones, it manages the cell membrane dynamics, which we talked about already, and it alters gene expression. So we understand that it is going to speak to our genes a message of life so that our genes are manifesting and expressing the phenotype, the code that we want them to read. I don't want the Parkinson's SNPs I may or may not have to ever be expressed. I don't want the cognitive impairment SNPs I may or may not have to be expressed. Part of that gene expression to be healthy is going to come from fish oil, omega-3 fatty acids.
Outstanding. You know, you talked about omega-6s. You talked about omega-3s. My man's having coffee. We're having a little coffee break together. I love it. Organic, of course, right? Let him know.
Oh, yeah.
Organic.
Oh, yeah.
Oh,
Organic
yeah.
for sure.
So omega-6 is linoleic acid. People should think about it essentially, for the most part, it's pro-inflammatory. There are some instances it's not, but let's think of it as pro-inflammatory.
Yes. Yes.
Omega-3 alpha lipoic acids breaks down to EPA and DHA.
Mhm.
And they have vastly different properties, EPA and DHA, and that's what we call our omega-3 fatty acids, or our fish oils, if you will. And that's what you're predominantly speaking about right now.
Correct. And let's go back to that. So alpha-linoleic acid, when you look at that, people say, why can't I just take flaxseed oil? Why don't I just use that? That's an omega-3. Well, as you and I know, less than 2 to 5% of the alpha-linoleic acid in flaxseed oil makes it through the enzyme conversions down to actually getting EPA and DHA. So am I opposed to flaxseed oil? No, use some for some constipation, use some flaxseed ground for some fiber, but don't use that to try to boost up your low omega-3s because you're just never going to get there to the degree that you need. It's interesting. They did a study. They wanted to look at DHA in particular. We talk about EPA and DHA. We know that DHA is the predominant fatty acid in the brain, the retina, these parts of the nervous system. And so they did this study. I don't know how much they spent to do this, but they wanted to find out what's the best way to improve or increase DHA in the body. And the summary was quite simple. The best way to increase DHA is to take DHA, and so we have this deficiency. So don't try to go upstream, especially when you can have EPA and DHA delivered directly to you. We understand that's where all of the chemical processing is occurring, is with those downstream components.
It's funny you mentioned flaxseed because I had Udo Erasmus on.
Okay, yeah.
And he's definitely a luminary, if you will.
Yeah.
Great guy. And he's all about flaxseed oil because he was the first one to theoretically convert flax seeds to flaxseed oil. So, and he's big about essential fatty acids and everything of that nature, but he does not like fish oil. And I felt that was a real big chink in his armor. How do you deal with somebody who doesn't understand the idea that there's multiple enzymatic conversions and nutrient enzymes needed to convert flaxseed to EPA DHA?
Well, I think the proof's in the pudding. And I'll mention this later, or we can even hit it now. I test, don't guess. When you can do a test and
Mhm.
you check someone omega-3 level, and I say, hey, you want to go, you do your flaxseed oil, and you have an omega-3 level of 3.15%, and it
Mm.
should be 10% or higher. You do your flaxseed oil for 3 months, let's recheck it. Take it to the bank. It's not going to 10%. So the proof's in the pudding. Now I'll say, hey, now let's go ahead and put you on, 2 to 4 grams of EPA and DHA a day. Let's recheck that omega quant in, 90 days or 120 days, and we're going to see that level start to rise. So I think the proof's in the pudding. Obviously, clinicians are a little bit easier because you can just take them to a physiology textbook and say, well, here's the biochemistry pathway. This is what it's doing. But to a patient, that you don't want to get lost in the weeds of biochemical pathways. As a patient, most doctors don't want to get lost in the weeds of biochemical
Right.
pathways. So I think the proof's in the pudding. Do the test, don't guess, and then implement your therapeutic trial of care. And then how's the patient respond? And that's the big way. That's the selling point that I use.
I use the omega quant also. You're at 10%. They recommend about 8%. That's a
Mm-hmm.
percentage of omega 3s in your red blood cells. We will come
Correct.
back to that. Let's give them a little bit more background. Let's differentiate. So we have EPA and DHA. So
Mm-hmm.
for me, I always tell everybody EPA is the anti-inflammatory portion of the fish oil. DHA is the cognitive one.
Yes,
EPA mediates cellular inflammation. It inhibits an enzyme so we don't produce this thing that I know we're going to talk about called arachidonic acid. Do you watch Indiana Jones? Do you watch
I
the
don't.
movies? Oh,
No, I
okay.
don't.
Harrison Ford, one of my favorite characters. Indiana Jones hates a few things. He hates snakes, he hates Nazis, and he hates poison. They used arachidonic acid in that bottle that he hates so very much. DHA is interesting in that it takes up more space in the membrane. And as you said before so articulately, it makes the membrane more fluid.
Yeah.
So take EPA, DHA, put them together, and give me some of the health promoting properties.
Great point you bring out there. EPA and DHA, they while we use them together, there are some opportunities for us to look at maybe trying to highlight or increase maybe just DHA, for example,
Mm,
cognitive impairment, retinal issues, those kind of things. But I think your categories are just perfect. The EPA with the anti-inflammatory component, the DHA with the cognitive component. But really, the magic happens, and I always tend to be using EPA and DHA together.
why?
And when we do that, if I'll talk about a study here later on, which is about the testing that you can increase your EPA, increase your DHA, so we use those together in higher doses, and we can actually stimulate muscle protein synthesis, which is going to decrease the loss of muscle in the aging population, which we know the number one predictor of longevity is the amount of lean muscle a person has. And so now we have fish oils introduced into this environment of maintaining healthy muscle mass, reducing risk of osteopenia, reducing risk of sarcopenia, these kind of things. Um, and so I think using them in concert together is critical. Um, and so again, though, if somebody comes in and they're like, "Hey, I've got retinal issues, I've got cognitive issues," I'm going to put them on EPA for sure because there's going to be inflammation, glial priming. There's going to be something going on there, and then I'm going to boost up DHA. And what's nice is we use some tools. I can give an EPA, DHA, and a DHA. I can mix and match to get the goal that I want met.
Yeah, I agree with you wholeheartedly. The ratios, the standard ratio, I think, in a good quality fish oil would be 3 to 2 EPA to DHA,
Mm-hmm.
higher if you're worried about brain. You mentioned the word longevity. Without question, the incisive conversation of now, the last 2 years, and maybe the next decade. Who really
Mm-hmm.
knows? There's a study that said if you take 2 grams of EPA DHA, you extend your life 5 years, and that's five
Wow.
years of healthy life. I'm 59. Give it to me.
Right. Yeah.
Put it in my veins. Here's another one for
Right.
you. 4.7 years of Alzheimer's free life if you take those 2 grams of omega-3 fish oils.
Wow.
And and as you said, delayed onset muscle soreness, muscle growth, muscle protein synthesis, hand grip strength. I think we're making a compelling argument for everybody to take fish
Yes.
oils.
Yeah.
So
Let's make a few more. So we know that fish oil can actually reduce neurodegeneration risk. We know that it can reduce neuroinflammation. I don't remember when you went to school. the glial cells of the brain, we were kind of taught, oh, just scaffolding, it's just there as structure. And now we know these are the immune cells of the brain, and glial priming can get turned on, and it leads to these terrible conditions, ALS and Parkinson's and Alzheimer's. And I think people are really wanting to, they want to live longer, but I want to remember my longer life. And when you look at fish oil, it's going to impact both of those. It's going to actually reduce my neuroinflammation, reduce my risk of cognitive impairment, and it's going to help me have to live longer. That's really what I'm after. We know you are the gut-brain superhighway expert, and we look at the impact of omega-3s on leaky gut. I tell patients all the time, you need 4 things to heal your leaky gut: vitamin D, glutamine, zinc carnosine, and fish oil. You cannot have a healthy gut without fish oil.
Love them all.
So you got to have that healthy gut repair. We look at hormones already. I mentioned when a woman comes into me, and we do a lot of hormone testing. We'll do the Dutch test, we'll do serum studies, but I'm not jumping into that until I see what their fatty acids are, because hormones are not going to work without the cell membrane dynamics being in play. And so let's check that first. Let's normalize that. And I'll tell you, it's amazing to me the number of women that come to see me and they're like, I need this, this, and this. And I'll save them $600 to $1,000 of testing just by simply doing an inexpensive fish oil test, seeing that they're low, put them on fatty acids, and 90 to 120 days later, they're like, I'm feeling better.
I agree with you wholeheartedly on that as well. So I love the microglials. So for everybody listening, there's a thing in the body called macrophages. They're kind of like your Pac-Man. They eat up cellular debris. They do a good job when they're in what we call an M2. I'm not trying to get geeky. Dr. Charles knows what I'm saying. An M2 fashion. If they're in an M1 fashion, they overeat and they are pro-inflammatory. Microglials or macrophages of the central nervous system. The data is robust that these microglials are now attacking the brain and therefore leading to a lot of neurodegenerative disease. As a matter of fact, we all know that Alzheimer's is an immune dysfunction of the brain. Now, you mentioned the gut-to-brain axis. Omega-3s are great for increasing the biodiversity of the gut, and that improved diversity increases the number of species of healthy bacteria in the gut, which leads to overall quelling of inflammation in the body. And I'll hit you with one more. Omega-3 fatty acids stimulate vagus nerve tone.
Yes, that's huge.
And I mean, we could have a whole seminar on vagus nerve tone, but before we go down that rabbit hole, this is not something that we discussed before, but I know you're ready for it. Omega-3 fatty acids, in theory, are supposed to convert to something called resolvents.
Yes.
But just like flax seeds to flaxseed oil,
very low conversion.
So what do I do? And wait a minute. What are these, if you will, pro-resolving mediators, Dr. Charles?
Well, I tell you, what a great point you bring up, because this is so exciting. Charles Sirhan, who's really published a lot on this. But I remember even going back to my old Guyton textbook of physiology and him writing about resolvins and then seeing the impact of these pro-resolving mediators. I describe it like this to patients. When you have that, you mentioned the macrophages, you have those Pac-Men that come in. If I have damage to tissue, or if I have a pathogen, a chronic infection, that's going to lead to neutrophil infiltration, that white blood cell that comes in and it converts to these macrophages that come in and try to eat up the debris. Well, what happens, and this is simplistic, but what happens is when it gets into the tissue, a little stopwatch is started. And it's going to, in the next 10 to 12 hours, that debris field better be pristine. Because if it is, great. Inflammation has resolved. Point A, point B, point Z, all the way to the Z point. Now I'm done. It's resolved. Everything goes back to being healthy and happy. But if I get stuck and the timer goes off and mom comes in and inspects the room and your room's not clean, you're not going out tonight. You're grounded. And so that's what happens. And the whole process starts all over again. And we never get from point A to point B. We have people that are living, if I use the alphabet as an analogy, that are stuck at letter M or letter N all their life because they're so chronically inflamed so much immune debris that they're never getting the resolution of inflammation, where the PRMs are fantastic. With pro-resolving mediators, they're not really anti-inflammatory. We need some inflammation to drive proper immune function, as you wrote about in immune review. But you have to be able to resolve the inflammation appropriately to have it get to a place now the immune system can say, I don't have to be on hyper alert any longer, and I can be healthy. So the next question always is, do I take fish oil or PRM? Yes.
Yeah,
I
agreed.
like to use both. And so I will frequently, almost, I cannot think of a patient right now that's not on EPA DHA, and that will also be recommended PRM. Now, the nice thing about PRMs, they don't have to be very high dosing to have a really beneficial effect. Right. So you can add in a couple of capsules to your supplement stack and not be a really big burden for somebody, but profound results, because you mentioned it already. Just like flaxseed oil doesn't get down to EPA DHA, it's a very small percent. I believe it's less than 12 to 15% of the EPA and DHA converts to the resolvents.
Great discussion on pro-resolving mediators. You know, you and I both lecture nationally and internationally, and it's still a little, no pun intended, a sticking point for a lot of doctors not really getting around what you just discussed. I try and let them know that inherently in the word resolution, resolve, it allows for the resolution of inflammation. Nothing does that as effectively, not turmeric, not ginger, not omega-3s on their own. So the example I use is, think of a 6-room house. You have turmeric. It shuts off the inflammation in one room, ginger one room. Because pro-resolving mediators are a lipid class switch, it's the master switch for inflammation. But like you said something that was very poignant in that it allows for the initiation of resolution, but it doesn't let it go too high, but it doesn't allow chronic inflammation to run. And that's the problem in America. Everybody's inflamed. Our patients are pre-inflamed. And I think COVID really showed that, because I think that's what led us to this idea of a cytokine storm. And I agree with you. Pro-resolving mediators with fish oils, because the fish oils have something called a mycin, again, not trying to get too geeky, that work for inflammation in the muscle, and the pro-resolving mediators don't necessarily do that. They do an overall inflammation switch, and they do an overall nerve switch. So everybody, PRMs, pro-resolving mediators with omega-3 fatty acids. So I hear the question, they're going to say, is all fish oil the same then? Can I go to Costco? Don't worry about for the companies you guys carry. Give me Costco. It's $8.
Boy, that's a big, hard no. Don't go anywhere. Like that's my soapbox issue. That makes the hair in the back of my neck stand up and my blood pressure rise a little bit when someone says, "Hey, I went to GNC or I went to Target or Walmart or a big box store and I bought fish oil because it's cheaper." Let's just talk about quality off the table for a second. Look at the dosing on the label. So I had a guy come in years and years ago, and I was doing a talk here at the clinic, and I mentioned that the high quality pharmaceutical grade fish oil supplement that I carry and I prescribe to patients is superior to what you can get. And he kind of blurts out, "Liar." So I kind of stopped, and I just kind of talked to him a little bit. And he says, "I went to Sam's Club and I could get it." And he named the bottle size, and he named the price he paid. So I want you to do this. I want you to go home and I want you to look at the dosing of the capsules that you're taking from Sam's Club versus the dosing of the high quality that I'm giving you. And he would have had to take like 25 or 30 capsules a day at this time to meet 2 capsules of what I was prescribing. So it actually became cost prohibitive for him to take the junk product. But now let's really take price off the table, because the most expensive treatment is the one that doesn't work.
Yes.
Quality is huge. And so we understand that our fish industry is being altered by just toxins in the environment. You do not want a fish oil that's going to increase your risk of mercury, lead, PCBs, dioxins, and these things. So you want to use fish oil that's been obviously clean, but also third-party certified to be pure of any contaminants. So we like to use and we like to eat and supplement with the SMASH fish. SMASH is an acronym. Sardines, mackerel, anchovies, salmon, herring. These are going to be lower on the feeding scale, lower levels of heavy metals to begin with, but then they're also going to be processed in a way that's not going to be allowing the accumulation of these toxins. There's a study I present when I lecture to doctors. I do a 48 hours program as you do. And when I lecture to them, there's a slide that shows that people who use fish oil that is contaminated, it will alter their lipid. So, hey, I've got triglycerides of 170. I've heard that fish oil can lower triglycerides, and it does. I take this contaminated fish oil, my triglycerides go down. Must be doing good, right, doc? Not so fast, because they show that the oxidative stress increased, increasing cancer risk because of the chemicals that were in the fish oil. So buyer beware. You want a very, very clean fish oil. And so that's a big issue for me. Quality is paramount when you're coming to fish oil, especially when you're doing things, we'll talk about more in dosing, but when you're doing higher doses for short periods of time, I don't want to bioaccumulate toxins. I don't want that parking in the parking places of my cell membrane, because the fats I ingest are going to go and they're going to park themselves in my parking spaces of my cell membrane. It's going to be either nice cars that I want to have there, or it's going to be junky jalopies that don't start and I can't move out there, and they just sit there forever and the wheels fall off and they're sitting on cinder blocks. And so that's going to cause alterations. And so quality is paramount.
I agree wholeheartedly on that. Again, you've got me a bunch of times. I'm sweating. I'm getting so excited. And to see that, to get the hair up in the back of your very calm head, this is this is at the top of the mind of consciousness. This could be our capstone moment together, without question.
Yeah.
So fish oil quality, purity and potency, like you said, no mercury, no PCBs. Freshness, Totox, that's the oxidative thing. So if you ever looked at the scale, you want it less than 26, so you don't want too much oxidation. You can open it up and smell it. If it smells like fish, it is not a dish. Get rid of it.
So good. Yes.
Bioavailability. And I think we should talk a little bit about third-party certifications. There's some quality third-party certifications, and you want transparency. You want transparency about the sourcing, the processing, and how they get the method. And ask them, where do you catch the fish and where's your factory? So if you catch the fish in Norway and you come from Norway and you go to New York, Westchester County, that may be a little bit of time. And people say, well, I don't know what you mean by that. I said, do you ever see the movie The Perfect Storm? They had a long way to go to save the fish and they needed some ice. And that's net caught fish. You want to use the line caught fish. So everybody, the net, I am not a fisherman. I'd rather watch grass grow. Apologize to everybody. Here's the net, and you're grabbing a whole bunch of fish, and you've got all these fish to deal with, as opposed to line caught, catching the fish and taking out the essence, the guts of it, and attending to it right there. How far line versus net caught? How far is the factory? And all these other things. And that's one of the reasons why they need to come to you, because I don't think they're going to get that delineation that they need in Costco, Vitamin, CVS, or whatnot, or even from a lot of other docs, because that took time. Because I know that I did the same arduous search.
Well, and that's the point. You're in it for a whole different reason than the big box store. You're in healthcare as a provider, and you did all the due diligence for the background search to find the companies that you feel are valid, that meet the criteria to help your patients. Because really, by extension, I can only be as effective as the tools that I use. So it'd be foolish for me to say, hey, yeah, go buy this junk product. And when it doesn't work, it's going to make me look bad. I want to be as effective as a clinician as I can be. I want to help as many people as I can help. And my tools that I use matter. And so like you've spent time to say, hey, you know what? I've vetted this. I've looked at this. I understand all of your advanced degrees in nutritional training that you went, because your focus is on the health of the patient, not trying to make a quick buck and then here and gone, at a big box store. And so that's where I think going to a reputable clinician that has vetted. I'm leery of people in the functional medicine realm or in the nutritional realm that say, oh, just go to your health food store, where the guy behind the counter didn't graduate biology. And he's going to tell you, hey, take this because I just read it in Reader's Digest or something. I'm opposed to that. I want them doing and using the same things that I would give to my wife, who I love, and my 3 kids, who I love. If it's not good enough for them, why in the world would I give it to my patients who I care about? And my goal, again, this is we're not in a sick care model. We are operating in a healthcare model. Just be very frank. The sick care industry makes money on fat, sick, nearly dead people.
Right.
If that's where I make my money, I want to keep them on fat, sick, nearly dead. Now, full transparency, I make money on healthy, well, optimal individuals. And so I want to get them to that level. And to get them to that level, I have to use healthy, optimal, good tools to do that. And then they don't need as much assistance. They can become educated on this. And as they start to turn their brains on because they're using good product, they can do the research now and say, oh, this is why I'm doing this. This is why I'm doing this. So
I thought you explicated those points really well. I just want to add a couple of things to pull them in from right field. Disc injuries. We're both chiropractors. That's our origin. So the intervertebral disc, 2 to 4 grams of omega-3 fatty acids, real popular. It's that time that I like to do. It's called rapid fire. I know you're from North Dakota, so strap in. Let's see where you can go and what you can do. Doc, you know what? I don't want to take those fish oils. Can I get enough from food alone?
possibly. But here's the situation. Ask people how many like sardines. Most aren't eating sardines. I love sardines. Sardines and avocado, I love them. Um, you don't want to eat swordfish. Don't. One serving of swordfish is going to exceed your lifetime exposure to mercury. You don't want to go that route. So people are just not going to have the dietary expansion they need to get it from diet alone. I've not seen people be very optimal with diet alone. I do believe that supplements are going to be very necessary for that. 1 to 3 grams for general maintenance. I like 3 to 5 grams a day of EPA and DHA for cardiovascular disease prevention. If I want to lower homocysteine, if I want to reduce the stickiness of my blood, I want to prevent atherosclerotic plaquing, I'm going to go in that range. So that's kind of the dose that I'll use for that. I think you can't get that in diet alone, in my opinion.
Omega-3 fatty acids, good or bad for triglyceride levels?
Very good.
Omega-3 fatty acids and healthy body composition, yay or nay?
Definitely.
Omega-3 fatty acids for recovery from muscle injury, like a pain-free end result. Because the reason I ask you that, there was a study that showed that just 2 grams, the amount that you recommended, reduces joint pain and the need for non-steroid anti-inflammatories in 60% of the patients with neck and lower back pain. So instead of aspirin, non-steroid anti-inflammatories, Aleve, ibuprofen, you can take 2 grams of fish oil. They are more effective.
Which those NSAIDs and aspirin and ibuprofen that you mentioned create leaky gut. Fish oil heals leaky gut. Leaky gut, you need 3 things to turn on autoimmune disease: genetics, environmental exposure, and leaky gut. So now you're creating the environment where now you can turn on chronic disease and autoimmunity. Don't do that. Avoid the NSAIDs when you have something so safe and natural. 2 grams of EPA and DHA. That's super simple. I can get that in 2 capsules.
2 capsules that we talk about daily. You know, really interesting. We talk about the gut. I mean, NSAIDs damage the blood-brain barrier. They do decrease pain. They impair healing. The nutraceuticals, the fish oils you're talking about, decrease pain and promote healing. Which do you want, Mr. and Mrs. Patient? It's just a real simple conversation.
Yes. Yeah.
So you alluded to a test, Omega Quant. We both use it in our office. And Omega Quant tests for several different things. Let's start with testing for just omega-3s.
Okay. So very simple. This test will look at omega-3s. You do a finger poke. You send it to the lab in South Dakota. They're going to tell you, where are you at on the spectrum? They're going to say greater than 8%. I like to see it 10% or higher for the omega-3s.
Most people are at 4%, and it measures the amount it measures the amount of EPA DHA in your blood, specifically the red blood cell membrane. Omega-6 to omega-3 ratio. I'll give you one. Anywhere from 15 to 25 to 1 is the average American. So why don't you share the optimum and just tell them how to get there?
So it gets a ratio. So when you increase your omega 3s and you decrease the intake of omega 6s, think about processed seed oils, think about fast foods, think about processed foods. When
Hold
you
on.
decrease,
I'm interrupting you because I've
okay,
got this guy on it. I apologize for interjecting.
no,
There's this Instagram influencer, Lane Norton, smart guy. And he says there's nothing wrong. There's no data that says that if you take processed seed oils, they're detrimental to one's overall health.
well, I disagree with that. I
Yeah.
think there's plenty of research that is contrary to that statement. And here's the situation again. Look at the omega quant, which looks at the 6-to-3 ratio. It looks at your arachidonic acid and it looks at your trans fat. And I'll just take from being in clinical practice for 20 years.
Mm,
The patients that are consuming the most processed seed oils have the worst omega quants.
no
And
doubt.
so
Same
they
here.
don't get healthy. I can't change the parameters if I kept them on all the processed seed oils. So, and here's the situation. I'm not a researcher. I'm a clinician. So to me, the N of one matters. So you could come up and
Beautiful.
say, well, this research shows this, this, and this. I'm going to say, hey, listen here. Miss Johnson couldn't walk a block without severe pain, and she was forgetting her kids' names, and she came in with omega-3s levels in the can. Her 6-to-3 was elevated. Her arachidonic acid was off the chart. I took her off her seed oils and put her on healthy fats, gave her an oil change, increase omega-3s, decrease omega-6s, decrease trans fats, and now she can walk 2 miles and she can pick her grandkids up. That's really what I'm interested in.
I'm at a loss for words because that was wonderful. It's beautiful. I feel the same way. No processed seed oils, and I've limited a lot of grains.
Mm,
I heard someone just talk about gluten, and everybody knows I'm anti-gluten, and I know you are also. So we don't have to, hunt that buffalo, if you will. However, somebody just said to me, when you really think about it, gluten comes with grains, so it's inflammatory and spikes your insulin reaction as well. So if you guys want to decrease your omega 6s and have a possibility of getting a good ratio, you should decrease grains. There was a book out, it's No Grain, No Pain,
yeah, yep,
talking about the joint.
yep,
It's hard to get your omega 3s up, hence the fish oils.
right.
So interesting concern is those omega 6s, what do they turn into? Is that the poison that we talked about before, arachidonic acid?
Well, they yes, they can be, and they'll have that downstream effect of that poison. And again, just so we're not throwing the baby out the bathwater, there are
Sure.
some good healthy omega 6s, borage oil and even primrose oil, and those are maybe helpful for skin and for some hormonal imbalances. But this is where again I test don't guess because I'm going to get the omega 3s up, and then we might add. And we're talking like 250 milligrams or 500 milligrams of an EPO or something like that. You don't need to go very aggressive with it. But I tell patients this: your omega 6-to-3 ratio should be 4-to-1 or less.
Mm,
I've been taught that when it is greater than 15-to-1, it's not if you're going to get an autoimmune disease, it's when. And if you're at 20-to-1 or higher, it's not if you have an autoimmune disease, it's which one do you have. That's how impactful these omega 3s are on the overall health. But arachidonic acid, you can measure that on the omega quant, is that
mhm.
pro-inflammatory. We need some arachidonic acid, healthy immune, some oxidative stress. But when arachidonic acid gets out of hand, it actually alters the brain function. So it increases the glutamate excitotoxicity in the brain. Glutamate's the kind of accelerator of the brain. It dampens or inhibits GABA. GABA is our anti-anxiety neurotransmitter. It's the calming one that we think about. And it actually changes how the brain releases the cortical releasing factor to create stress. So high arachidonic acid makes you more stressed. Well, stress, toxins, malnutrition, that's what's killing us. And so
Effective.
we have to get that arachidonic acid down.
Yeah, neurotoxic effects of arachidonic acids, to add to what you said, they create free radicals. They can amplify the effects of amyloid, which comes from the gut. Obviously causes overall brain inflammation, cell death. Now, you talked about glutamate. Glutamate, as you said, creates excitotoxicity. It opens up what we call this synaptic cleft and causes calcium to go from outside the cell to inside the cell where calcium now can plaque. By the same token, conversely, it allows potassium to go from inside the cell, which is a great source of energy for axons. It goes outside the cell and it damages the axons. Now, one of the things that you may want to take with omega-3s, if you're concerned about neurotoxicity, may be taurine as an amino acid, just to bring that in from left field. One other thing I wanted to add, a lot of people ask me, does omega-3s work synergistically with anything else? Obviously, we've added pro-resolving mediators. Good data on it adding a positive effect with probiotics because it creates a stickiness to the epithelial cell on the gut. Got any other factoids or gems you want to share?
Well, let's throw in that great. I love the NMDA receptor, and I love that calcium influx picture that you just painted for us. And taurin's a great thing for stabilizing the neuronal membrane. Also, magnesium, because magnesium is the cap of the NMDA receptor. Stress depletes magnesium. If arachidonic acid's high, I'm stressed. Stress depletes magnesium. So now I've got a fatty acid imbalance. My brain is shrinking in size. I've got unstable neurons. I've got NMDA receptors with calcium just blowing in there, causing catastrophic neuron degeneration. Let's throw some fatty acid into it. Let's throw some taurine and some magnesium into that picture and get that brain to calm down.
So it begs the question, really, what is the choice test? Or would you consider the omega-6 to 3 ratio a choice test to determine someone's inflammation?
I would do the omega quant, because that way I'm getting the omega-3, I'm getting the omega-6 to 3, and the arachidonic acid. Then I'm getting a really clear picture. How inflamed is this person really?
I know you've heard this, but this is for the listeners. I was told not to take fish oils because it's a blood thinner. So I'm going to get some work done on my gums. Take it. They said not to take it. Be careful. If you bump yourself, you may bleed inside, et cetera, et cetera, et cetera. Would you like the podium on that one right now?
Well, and I don't have the citations in front of me, but you can look at the literature. There is fish oil decreases platelet stickiness. Okay, so there's a difference between blood thinning and platelet stickiness. That's an important point. Yes. And there's research that shows better clinical outcomes on people who are on omega-3 fatty acids before and after surgery. So there is, and again, I wish I had the citation ahead in front of me, but you can find it on PubMed. And there is no risk. I'm trying to remember, I think it was Dr. William Sears who wrote a book called The Omega-3 Effect. And that highlights some of the challenges that have been really, the concerns pushed away. You're not going to cause excessive bleeding on 1 to 2 grams of fish oil. That's just not going to increase bleeding of any warrant to be concerned with dental procedures and surgical procedures or thinning the blood too much.
So it really begs the question. I think you've convinced everybody they need to supplement with omega-3s. They need to eat more omega-3s. So getting back to the idea of rapid fire, give me your 5 favorite omega-3 foods.
Okay, it's the smash fish for sure. It's sardines, which I love, but sardines, mackerel, anchovies, salmon, herring. That's my 5 favorite omega-3 rich foods. We can throw in there, I'm from North Dakota. My father-in-law has cattle, and it's grass-fed, grass-finished beef in North Dakota with a great omega-3 content. That's an option there. And eggs can be a great source as well. When
you say eggs, you mean the yolk with the egg?
The yolk with the egg, yes. You got to have the whole egg. And it should come from chickens that do chicken things. They eat chicken things. They eat the bugs. They're roaming around. Like, know where your eggs are coming from. You can take an egg from the grocery store and an egg from the farmer that you purchased it from that's doing organically, and you can tell a difference the moment you try to crack the egg. And then once you crack the egg, look at the yolk color. Like, it's a big difference.
Yeah, nice bright orange, going to be nutrient rich, kind of weak yellow, like the 7th time you go to the bathroom in a day. Just not going to do it.
No.
So dosages. Let's talk about dosages for the regular person. So again, we'll do this rapid fire. Adult male, adult female.
Maintenance 1 to 2 grams per day of EPA and DHA.
Now, interesting. I agree with you. 2 grams per day is what I usually do. if you haven't taken any omega-3s before and you put them on the first time, there's some data that says you may want to go up to 4 grams to build the
Mm,
cell membrane up. You see you're
I
nodding, so
agree.
that's
I
a
agree with
great.
that. Yes.
Now, here's the other question about that. What about 12 to 18-year-olds? We'll call them obviously teenagers.
Yeah.
What's the dose for them?
So again, the dose is going to vary. I depend it so much on that fatty acid test. But I like the idea of 1 to 2 general maintenance or
Okay.
2 to 4 for general maintenance. But here's the situation, and athletes that are in contact sports that have a potential of head injury, we may want to keep them on a 4 to 6 gram maintenance dose because we know that within 6 hours of a head injury, you're going to get leaky gut and you're going to have inflammation, so that you can have that stuff on board. I was just training with Randy Vaudry, who's a nurse practitioner from the West
Mhm.
Coast, did a master class with Dr. Karazian Institute,
Mhm.
and he was showing an omega challenge where he recommends with mild cognitive impairment or neurobehavioral issues, 10 grams per day for 6 weeks to see how the patient does. Well, that's wonderful. So you get a lot of wiggle room. So as you know, as a clinician, it's so hard to just say, here's a blanket statement, here's a cookbook. We don't practice cookbook medicine or supplements or nutrition. It's precision medicine for the patient. So the real right answer is find the dose that makes you feel the best and brings your numbers into where you want to be. If you're not getting where you want to be at 1 to 2 grams, bump it up to 4. You're not going to hurt yourself. And if you're feeling great at 4, stay there.
Root cause resolution will occur by precision medicine.
Yeah, that's it.
I
That's
think
it.
that's going to be the quote. You opened up Pandora's box about concussion. Number one athlete who gets a concussion is a female soccer player. Omega-3 fatty acids promote neural cell survival, reduction of cell death, reduction of oxidative stress, synaptic plasticity, neurotransmission. And here's the takeaway with any of your athletes that have a concussion: give them fish oils. 75% of the damage abates within the first 30 days. And here's the caveat to that: take the fish oil before, and you will have a tremendous declivity in concussions.
That's great.
So I'm going to be
That's
courageous. Let's go for it. I know we're going to raise the roof on this. How many grams in acute concussion, 200-pound high school male athlete, 18 years old? What are you going to give him coming in? Let's see who
I,
can lose their license first.
I would start at that. I would start at 10 grams. That's right. Start. That's a big boy with a concussion. And I mean, I honestly, you could probably even go higher than 10 grams.
Yeah.
Where would you start?
Yeah, 12 to 18 grams for the
There you
first
go.
week. I know I'm in a lot of trouble now. Here we
No.
go. And it would be a week, and then I would half it by week 2. You've got to get it. And you really spoke about something that was fabulous about leaky gut. It's those tight junctions that get compromised in a concussion, and they do so because of the dramatic decrease in vagus nerve tone immediately. And that would be a great conversation about the zonulin and occludin and LPS. The women a little bit less with the fish oils because they're a little lighter. So I'm very much like you, but I look at the body weight as
Yeah.
well as the ratio.
And can we just talk about this for a second? The obstacle we face with patients, they say, do you take fish oil? No, I don't take fish oil because I don't feel good when I do, or I get gastric
Burp up,
upset.
burp it up.
And here's what I always want to know. Number one, is it a quality supplement? If it's poor quality, that's why you're burping it up. But secondly, you have to be able to digest the fat. And if you can't, don't stop taking the thing that's going to help you live longer. Get your gut fixed. And you might need a 3-month, 6-month gut protocol, but get the gut healthy so you can tolerate the fish oil. Now we can stick them in the freezer. They can take it at night. They can do these things as a Band-Aid. But I just want to hit that point because so many people, I don't take fish oil. I tried them and they didn't do well with my gut. I burped them up. It's like, let's get your gut healthy. You should be able to take your fish oil at the doses that we're talking about. And I've already had 6 grams of fish oil today and I'm feeling great. I should be able to digest the fatty acids I'm consuming. So
Clearly. That is a huge takeaway, everybody. If you're burping up your fish oil, it's probably not the fish oil from a quality company. You have a digestion problem, and address it, please. So we come to that point in the podcast where my buddy, he watches him every week from Geneva. He's my guy. I'm his protector in life. And he says to me, Rob, with my Oxford degree give me 3 things that I can do on Monday to be better. So I'm going to tell you what he needs. He needs an oil change.
He
How can he
needs an
get
oil
one?
change.
What can he do?
Number one, increase omega-3s. And yes, by that I mean supplement. Take a good high quality fish oil. Secondly, decrease the processed seed oils. I'm just telling you, just try it. Do it for 30 days. If it works for you, great. If it doesn't, send Dr. Silverman some ugly mail and he can deal with it. But decrease the seed oils. And then I'm again, the clinician in me, the third takeaway, test, don't guess. You're using the Omega Quant, Dr. Silverman. You can help them get that. They can contact you. It's a very available testing that they can have, and it's so easy. The report's easy. Don't shoot in the dark. Know what's happening.
I'm sure he wrote those all down. And the last thing I want to ask, a lot of people say, hey, I consume extra virgin olive oil. Is it the same as omega-3 fatty acids?
No, it's not, but it's by itself. The polyphenol richness of extra virgin olive oil is high quality olive oil, which we could do a whole nother thing on. I love it. I'm pro olive oil, but it's not the same.
Right. It's an omega-9. We're talking about omega-3s. This has been extremely illuminating, to say the least. I greatly appreciate it. I had a prescient moment before I came on. I said, I think this is going to be as good a podcast as I ever had. I'm going to embarrass you a little. You don't do this a lot. I had to coax you to do it. Dude, you delivered. The ball went out of the park at 450 feet and it's still going. It hasn't hit the ground yet. I appreciate you. Thanks so much.
Well, thank you, Dr. Silverman, and thank you for your service to our industry and our field. As a clinician, you have helped me, and I want to thank you and for the opportunity to speak to your audience and what you've done. And the books that you've written have been a benefit to me. So thank you. I appreciate it.
And I appreciate all that I learned from you in this composite 53 minutes. It was great. And by the way, you were good at rapid fire. Everybody, Dr. Charles Sefcik, Robert Silverman, Proven Health Alternatives.